Hey, I'm Shelby. I'm being your nurse this evening. I'm going to do some hand hygiene and provide you some privacy. Could you tell me your name and date of birth?
Jay Mary, December 1st, 2000.
Okay, I'm going to look at your armband to confirm that. Don't wait on it here. I've got doctor's orders to do a head-to-toe assessment on you. So I'm going to start with checking your vital signs. And, well, I'm going to start with your blood pressure. You got 96/64. I'm going to check your radial pulse. So your pulse is 68. And I'm just going to stay right here for a minute. Your respirations are 14 and you are breathing eupnea, so regular breathing. Your radial pulse over here was a 2+. I'm going to compare them. Perfect, and they're both 2+ over here. And I'm going to check these. Those are 2+. Your posterior tibial was a 2+, and your dorsalis pedis is also a 2+. While I'm down here, I'm going to check for some edema. And while I'm up here, I'm going to check for edema and your capillary refill. Now I'm going to listen to your heart sounds. Over here. And I'm going to start with the aortic. Your pulmonic. Herb's point. Your tricuspid. And your mitral. Have you been experiencing any chest pain? A little bit? When did that start? Okay, well I'm going to make a note of that and give it to the doctor. Before I begin listening to your lung sounds, have you been experiencing any shortness of breath? You have. Okay, well I'll make a note of that for the doctor too. How about a cough or any mucus? No. Okay. Well, I'm going to go ahead and listen to your lung sounds. And I'm going to start on the right upper lobe. So if you take a big inhale and exhale. Oops, sorry. And then if you would cross this arm for me. Same on this side. Alright, and I'm gonna listen to your posterior. Your lung sound good. Have you ever used an incentive spirometer? No. Okay, well I'm going to educate you on that. So here's your incentive spirometer. So what I'm going to have you do is take a big inhale in, and you're going to hold that breath for 2 to 5 seconds, and then exhale slowly. And you're going to do that 10 times an hour or on your commercial breaks. Okay. And then what that is going to do is break up the mucus in your lungs and help you breathe a little bit easier. And I'll put this over here on your bedstand. Another thing that you can do is turn, cough, and deep breathe. So you just turn your head to the side, big inhale, and cough. Perfect. So while I'm up here, I'm going to check for jugular vein distension. If you look away from me, I'm not seeing any jugular vein distension. I'm going to start the neurological portion of your assessment. So the first thing I'm going to do, have you been experiencing any headaches? You have? Okay, we'll make a note of that. Everything looks symmetrical, everything's same color, everything looks nice and healthy up here. I'm going to check your eyes for direct and consensual pupillary contraction. Okay. So just kind of look out past me. And then if you would follow the tip of my pen light. So pupils are equally round and reactive to light and accommodation. I'm also going to check in your nose if you look up for me. Okay. I'm not seeing any mucus or drainage or anything. Have you been experiencing any difficulty breathing? You have? You're having a tough time. If you would, I'm going to check the patency of your nostrils. So if you cover up one nostril, inhale, exhale, and do that on both sides. Sounds much better than mine. So the next thing I'm going to do is I'm going to check your oral cavity. So if you open up your mouth for me, I'm going to look in here. Everything looks nice and pink and moist, not noting any missing teeth. Everything looks good in there. I'm going to check your ears. Have you been experiencing any ringing in your ears?
Yes.
Look in here. I'm not noticing any discharge from your ears. So I'm going to check your range of motion. If you would, move your ear to your shoulder and do that on both sides. And then chin to chest, and then tilt your head back. Perfect. Okay, and I'm going to check the range of motion for your wrists. So if you would, see what it is, push down. Okay. You got it. Alright, now keep your hands like this and then push up. Okay. And then now, I'm going to do your elbow. So push up here. Okay, push down. Okay. Push up. Push down. Okay. And I'm going to check your knees range of motion. So stick your leg out here. Alright, now push up. Push down. Same thing over here. Push up. Push down. Okay, so now I'm going to check your ankle. So push up with your toes. Push down. Okay, same thing over here. Push up. And push down. Okay. So another thing I'm going to have you do, I'm going to assess your gait. So if you would, walk to this door and back for me.
Right here?
Yeah.
Can we start right here?
Yep. Nothing fancy. You can just walk to the door and back. Like you're on a catwalk. Alright. Nice even steps, smooth gait. Perfect. You can have a seat. So I need to explain to you the Glasgow-Coma scale. So you get graded on 3 responses: your motor response, verbal response, and your ocular response. And your eyes responded well. You've been able to do everything I've asked you to do tonight. And I've been able to understand everything you've been saying today. Okay, I need to do your gastrointestinal portion here, so if you would lift your shirt up for me. Sorry. Okay, everything looks nice, same color. I'm not seeing any protrusions. I'm gonna go ahead and listen. Okay, I'm gonna start down here in the right lower quadrant and then move my way clockwise. I'm hearing some gurgling. Not so much there. Okay, so you've got some normoactive gut sounds, and I'm gonna go ahead and palpate as well. When was your last bowel movement? Earlier today, okay. Have you been experiencing any flatulence? Yes. Okay, well that's a good thing. You got things moving. Okay. Okay. Well, perfect. Well, I'm going to take a note of everything we've done this evening and pass it over to the doctor. Thank you.